Good evening, everyone. Welcome back to my channel, Coroni. Today I've got someone who's a friend, who's a close person to me. Today we're gonna be talking about the issue of thyroid and the lack of awareness that is out there, that a lot of people, especially women, they suffer from thyroid, but there's less information about it, and sometimes the doctors take time to detect that there's an issue of thyroid, because sometimes thyroid doesn't show that thing.
Yeah, thyroid is this gland. Everyone has this gland, but it should work properly.
Anyway, let me introduce you formally. This is Zianda, my friend. Yes, my friend from here. My friend, she's a sister, she's a friend. My crazy couscous, yes. So I've been trying to convince her for us to do this segment regarding thyroid.
And
so
I said
that
no a million times.
She said no a million times, because I felt that she can educate us, because a lot of people, wait, let me adjust. A lot of people, they are not educated or fully aware about the condition.
That's true.
So, Zianda, I'm about to interview you now. So, tell me, how did you discover that you've got thyroid? What happened?
Okay, it's a long history. Actually, it took almost 5 years for diagnosis, the actual diagnosis to come out. It started, I was collapsing. I've gained weight because I never used to be big. I don't know if you can guys see now I'm big. I'm a big girl.
You know what? I think I'll take one of your pictures. It's so that I'm still struggling. Yeah, I'm still struggling with.
You can take
let me take one of the pictures. Okay.
So they can see.
Yes.
Where do I come from?
This is how small she was. This is how small she was. Yeah, you can continue, friend.
So when I collapsed, the first time when I collapsed, the ambulance was called. I had to go to the hospital. They ran tests and they said they couldn't see anything. I had to be sent back home. And it happened often, like weeks after week, like 2 week, month or whatever. It passes like 2 years, I think. It was 2 to 3 years. Then the third year, what happened, I've gained weight like there's nobody's business. And I was not eating a lot. I was eating normally. I was going to the gym, but I was not losing anything. I went to so many fat diets.
So tell me, let me cut you there. So when you are fainting and all that, the hospital, I also know that in your family you've got medical people in the family.
Yes.
Nobody thought, what kind of tests were they doing when you went to the hospital? Because from what you told me, the fainting was a frequent thing. And then all of a sudden your weight just boom.
I think what happens, because I'm living in Durban and my parents are living back at home, and I do have relatives here in Durban and whatever, but because they were in shock, and sometimes I wouldn't even tell them anymore because I felt embarrassed, because it was something that it was shocking for me. It was something that I didn't even understand myself. But in the third year, when it getted to be serious because of the weight, my aunt, which is my mom's sister, which she used to be, she's a retired matron now. She used to be a general manager in a hospital as well. She said, no, man, we need to take you to the government hospital. What are these private hospitals doing? You cannot be in the hospital so many times and there's no diagnosis that is being found, but you can see it has nothing to do with food. We know you, we know how you eat and whatever, but you're gaining weight like this. Oh, and my stomach started to be bloated. That was the thing, because my parents thought I'm pregnant. I even cried because they took me. No. I was young at that time.
But I can imagine.
They took me, they did the test, the doctor confirmed no pregnancy, nothing, and they said this is not normal. My tummy was big. If you don't know me, you will think I'm like 4 months or 5 months pregnant.
Yes.
So,
and then in the meantime, before they found the diagnosis, what was happening with your self-esteem? Because from the pictures, Mina, when I know you, you're already a big girl.
Yes.
But when I look at your pictures that you showed me, and when you started to tell me that you've got a thyroid, you were a small girl. You were
tiny.
You were tiny. So what about? And you were a tertiary. I mean, you were seeing boys.
Okay, at first,
Your confidence.
At tertiary, it was not that bad because you know when you gain when you're tiny, it's like especially us African people, men were like, "Ooh, now you got calves." You know what I mean? It was for me. I was getting more attention from men, and I couldn't understand what was it. And for my friend, they were like, "Hey guys, let's try this, guys. Let's try." It was not a big deal at that time until I started working, where it was boom, like huge. I'm talking about from size 32 to size 40.
Yeah.
That's when it's...
Let's speed it up so that, because I still have more questions for you to ask you. Tell me about the time that you were diagnosed, what kind of tests were done, and how did they discover it?
Okay, so when I was diagnosed, I fainted again, as usual. Now I'm working. Young professional, junior, and it's so embarrassing, you just faint.
Yeah.
So they took me to hospital, they rushed me to the hospital. The tests were done. Again, they said nothing. Until my parents came, they said every test in the planet must be done.
Yeah.
I was done, scan,
this is at the government hospital?
No, I went back to the private.
Okay.
Because it was the emergency. So my parents, when they came, then they said the same thing and said nothing. They said no, run another test. There was a test. One of my cousins, which is a doctor, said they must do T3, T4. I remember correct at that time.
Yeah.
They said they must tick in the form T3 and T4. I didn't even understand at that time what is T3, what T4. But that T3 and T4 now, because I'm doing it or every 6 months, it's checking the thyroid level.
Okay.
Yeah.
So thyroid, in a way, it's an imbalance of hormones.
Yeah. Okay.
Okay, let's go how you were diagnosed. I think I'm jumping the gun. Let's go back how you were diagnosed and the tests which were done.
Right. So when they ran that test of thyroid, it came back, it says 200. 200 is the most highest when you can die. It was like almost like this for me to die. Because my thyroid to be normal, it's 0.04, if I'm not mistaken. They will correct me. But it has to be 0 point something. That's what I know. If it's normal, because I run every 6 months I run the test because I mustn't take overdose for my medication.
Yes.
So when they ran the test, they found that it's sitting on 200. Wow. And the specialist that I found that time said, no, I need to be rushed to the oncology center to do the radioiodine. It means they wanted to kill this gland which is producing poison when they explain it. Because everyone has thyroid, but it needs to produce the right gland.
Baby girl, but from my understanding, you didn't have a protruding neck. No. Your neck,
it was just normal.
Her neck was normal. Do you hear that? Because most of the time we think that thyroid is found by having a protruding or swollen neck.
It's not everyone.
It's not everyone.
The only change that it was visible that we all didn't understand. You can guys see. You see my neck is dark. Although I'm not light skinned, but my neck is more darker than when you look at my skin, when you look at my body. You can see my body. My neck started to be more darker. It was not, it was abnormal, but I didn't know what was it.
Yeah.
Even someone make a joke that I have to bath properly. You know how people
are insensitive and they're not even educated. That's the thing.
Exactly. Yeah. So that's what happens. So as time goes on, I went to that oncology center. I did a procedure called radioiodine. But what they did, yes, the procedure was done and it was fine. And then they tested and said, my thyroid is normal. The problem that they did, the mistake they did, they didn't put me on any medication.
Yes.
That year, everything was cleared. I was not on medication. The following year, and I started to lose weight a little bit.
Yeah.
I think I went back to size 36, which I was comfortable because from 40 to 36, it was fine. It was not bad. Then after that, boom, I started to gain weight again. Because I knew what happened before.
Yeah.
I went to the doctor and I've explained what happened and I've explained my condition before. And then the doctor said, no, I need to rush you to the specialist. You need to take the test and see what is going on. Then the specialist said, you know what, these people, when they did a mistake, not put you on medication. Immediately when you've done the procedure.
Yes.
Because this is going to be your life.
So what you are telling me is that now thyroid is categorized as chronic.
It's chronic, yes.
Chronic in
I'm
a sense
chronic
that
now.
She takes medication daily.
Every morning.
For the rest of her life.
Exactly. It's on chronic now.
Okay.
So after that, I didn't have to be hospitalized. I was have to be using specialist, not just a normal GP.
Yeah.
For almost 2 years.
Yeah.
Because my thyroid was up and down. It was being up, down, and also at first when I was diagnosed, the first diagnosis, it was hypo, which means it was
because there are different kinds of thyroid.
Yes, there's two types.
Please explain that one.
There's hypo, which I am suffering from. It means hypo. It's under. This gland is not producing enough hormones for my body to able to sustain itself, to able to function properly as other people. So if you diagnose with hypo, it means the side effect comes with it's gaining weight. It's also you lose interest of many things.
Tell me about depression.
Yes, depression.
Yes.
It's where you don't realize you're depressed. I started not want to go anywhere. I started want to be on my own most of the time. Even when I'm home, I will close my door. I want to be with myself. It will take me an effort to go out with people.
I know that I have to drag you out.
Yes, it's an effort. Even if I'm with people, I will be disconnected.
Yeah.
You feel down, no energy, nothing. Even when you try to lose weight, no matter how hard you try, you can eating right, go to the gym, it will never shake. If it shakes, it means you have to be like extremely. At one point, I was doing 2 hours in the morning and afternoon. Obviously, your body is gonna be tired.
Yeah.
I've shed maybe only 5 kilos a month.
So tell me, babes, because you work in a very environment which is very active in IT and all
very
that.
Stressful.
Very stressful and sort of perceived as male dominated.
Yes.
And you've got a condition that also it dampens your spirit and also it makes you have a fatigue, tired.
Yes.
How do you manage? And you have managed to do well in your career. How did you manage with this condition and how it made you feel and to excel in your job?
At first, it was not easy. I won't lie to you. I went to the state of depression. Although I thought it's only because I lost my brother. We were very close. But when I was admitted to hospital in psychiatric hospital for a month. When I was doing my therapy and everything, it came out. There was underlying things like work. I have to be hard. I have to push hard because when I first started, I started as a programmer. I was the first black female in the team, so I had to work 10 times harder than the male peers. So when this thing happened, I was pushing myself. I was closing myself to work. I would work from Monday to Sunday.
It didn't affect your social life.
It did a lot. I lost friendships. I think other people, they're not. I don't blame them because I was not explaining what was going on.
You were not ready.
I was not even know myself what is going on with myself. So as you can understand, we're still young. Everyone wants to hip and happening, go out, and then they don't want this sagging friend who today doesn't want to go out, tomorrow she doesn't want to talk, because this thing, the way it affects you, you'll wake up in the morning, you just want to shut down. You don't want to see the world. You don't want to see anything. You don't want to talk. Let me be honest. I didn't realize that it's depression. So it did affect my career in a way, but because I'm a hard worker, I was compensating with that. I never being a good communicator.
Yeah.
And
so you were speaking with the computers.
Exactly. That's why I wanted to sit behind the closed door, because I didn't want. I felt like I don't want to talk to people.
So it's been how many years since you've been diagnosed?
I was diagnosed. I should be diagnosed in 2010. I think I was diagnosed.
It's 10 years now.
Yeah.
And by the time you were diagnosed, already 5 years or 2 years had passed.
Yes.
So which means it's around 15 years.
It's around 15 years.
But when I listened to your story, I was very amazed or shocked that for so many years, doctors didn't even think of having that test, thyroid, done. And I think that is one of the things that I remember. This other woman, I was watching this other woman, she was talking about fertility, and she was talking about she had done all the fertility treatments, all you can think of, until she just saw a doctor on the road and she went there, and the doctor wanted to put her on this treatment. She's like, I've done that, it doesn't work. And that doctor just said, let me test your hormones. Let me test your hormones, how your hormones are. And when he did the test, he found that her hormones are, she said the numbers, it's just that I didn't grab the numbers. But once her hormones were balanced, she was able to conceive, and she's got 3 kids now. So that is one thing that I think medical doctors have to check, the issue of hormones.
Because the thing is, they concentrate on your history. They will ask you, do you have anyone in your family who's diabetic? And they will do, those general tests.
Yeah.
BP, cholesterol, diet, you name it.
Yeah.
But they will just miss this small thing. Because if they realize it or they diagnose it early, I wouldn't even come to a position where I have to gain so much weight.
Yeah.
Because I would have known and I would have started with my medication.
So the thing that also made me ask it, can we do this segment and talk about it? Because I realized there might be a lot of people out there, women or even men, I don't know, who are struggling with weight, and they're doing everything that they can, but they've gone to the doctor and everything, they've never been tested for thyroid. And even if they go to the doctor, they are not really going to a doctor who is a specialist with thyroid. And they are not gonna, he's not gonna, or she, treat them holistically, they will, and see this thing as a lifetime thing. It's not a medication you take once a month and then it goes away, because these are hormones which needs to be balanced for life. So you find that a person has gained weight, their confidence is affected. And the other issue is that when your weight is ballooning like that, I can imagine you become also closed off, you become aloof, and you are harsh to answer, because you are defending yourself. You even yourself don't understand, why is my weight ballooning like this? And
you know what worse, when people that that they know you, they were like, oh, you gained so much weight, you're eating so much. I've been told at some point, because I got brothers, oh, you're eating a lot, your brothers are starving because you eat all the food. All those words, they are so painful, because deep down inside, it's not about how much I eat. But these people, they don't understand what it's going to. Even when I was diagnosed, when I started to explain myself, no, I suffer from thyroid, blah, 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 they were like, oh, you have white people's disease.
Yes,
and they were like, start laughing. And until I get to a point to understand, I don't need to explain to anyone.
But what people don't understand, it doesn't mean if you are not aware of something, you are not educated about it, you mustn't take that it's a racial medical condition. No. I know about 2 people, I think they told me that they've got thyroid. So, but you need to ask yourself, how many people do have thyroid and they're not aware? And remember, it's not everybody who gains weight like Z. It's not everybody who will gain weight, and it's not everybody who will have that sign, way to show that you can show that this is a sign of thyroid. And there are different types of thyroid, like she explained.
Yes, and the second type, it makes you lose weight. It's different now.
Yeah.
It makes you lose weight, but you lose hair.
you also lose hair.
Your confidence will be gone, because no one wants, especially if you're a woman.
Yeah.
If you're losing your hair, it will make you feel tired all the time. You will have all the depression will kick in as well.
Yeah.
Because you don't understand. You will think, and then the next thing, people will diagnose you, will be like, oh, you're sick, you're sick, but you don't know what is it. If they don't run those tests, they will keep on saying you're fine, but you are not fine.
Yeah. But you know what? I don't know how we can bring this awareness that even doctors can. I think doctors are aware of thyroid, but I don't think they are really clued up. It's not like diabetes where you get sick, they want to start, let's do diabetes, let's do BP. You know what I mean? But from what I see, I think thyroid must be one of the tests that it must be. One of the tests that they do. It must be done. So
sorry to cut you.
No, it's fine.
Even now, if I can get just sick, let's say a common thing like flu, maybe I feel like maybe you can rush me to the hospital. They will never do thyroid test. They will ask me what is wrong with me. If I don't know, because I always tell them I suffer from thyroid. I take medication. I take this dosage. This is what I do. This is a kind of tablet that I take. But think about it. If I don't know myself, they will never do that test.
So tell me, babes, how have you managed? When did you come to accept it? That you've got this condition. How did you come to accept that your body will never go back to this? Even though you're still baby girl for life. How did you manage to accept it and have and tell yourself, this is my life now, but life still has to move on and I have a fulfilling life?
Okay, I won't lie to you, it was not an easy process to just even process to buy clothes. It took me years to buy clothes. I was wearing same clothes, black clothes.
Black clothes.
To make
it look smaller.
Yes, because they're stretching. Sometimes I don't get stretching. I was wearing same clothes. It took me years for me to come out to say, this is me. And I think the most thing that helped me is my family.
Yeah. With
the understanding, I'm so blessed to come from a family where they are knowledgeable when it comes to
medical things. Anyway, you've got few people who are in medicine in your family. So
my family and I'm so blessed to have brothers. I don't have a sister, I have brothers. My brothers will be like, hey, you're okay, you're fine, don't worry about it, don't worry. Even someone in the family will say nasty thing about my weight, my family will jump and just defend me. So their assurance to say, you are fine. There's nothing that you cannot do just because you are gaining weight, because you are in this condition, you are okay. And I've got few friends that surrounded me also who understand me, like who be like, you know what, it's fine. Take your time. Like her, she's very understanding, because even now, I will have those. It's because now I understand what is going on. I will have those imbalance hormones where I feel I don't want to talk. I don't want to go. We will have a plan. I will tell her, no, not today. I'm not okay. I'm switching off my phone.
Leave me alone.
I'm switching off my phone. I'm not sick, but I just want to be on my own and whatever. But I've learned that I don't need to explain myself to everyone. To people that means a lot to me, which are closer to me, and that's it. Work-wise, therapy helped me a lot how to be professional at work. If I feel in that condition that I feel like I don't want to talk, when I come in the morning, I will greet, because I work, it's male-dominated place.
And the male-dominated
they talk about everything.
They want extra respect.
Exactly. So when I come in the morning, when they start with their jokes, and I will be like, hey guys, how you doing? Hey, today I don't feel like talking. And they were like, hey, it's that time of the month. They will make a joke, but they know. They will just leave me alone. I will do my own things. But if it's for example, it's a outside person like users, we deal with IT, we call clients users. If it's a user, I will gather myself and be
arrest
myself
and hold yourself,
hold myself and be professional and deal with it until the day is over.
You pointed out a very important thing. You know, that is my motto, that there is no harm in therapy. Black people, let us start going for counseling. Let's start going when you know that you are not coping. Because if you're not coping, how are you uncluttering all those emotions and things? And sometimes, like she said, because it's a medical condition, the imbalance of the hormone, the depression can come up so strong and all that. So you need all the help. There is no shame in going for therapy. Me, I do go.
I've been in therapy for years.
Yeah.
I have no shame on it. It helped me a lot. I think I wouldn't able to cope with my career, and very demanding as it is, and with my social life as well, even family. I wouldn't able to cope, because if I was not going for therapy, I'll be lashing out on people. Because this thing is like a monster. It wants to, you keep quiet and you want to come out.
It's like a beast inside which wants to come out.
And the next person will be like, what happened? Because I thought we were just chatting.
Yeah.
And now you need to control this. You need to control your emotions.
Yeah.
So you need to learn. You need to be taught how to control them. You need to understand your body. You need to understand yourself. That, you know what, I'm feeling some type of way.
Yeah.
That's why some conversation I step away from them, because you need to understand yourself.
Because they can be a trigger for you.
Exactly.
They can be a trigger.
Because you'll find people say, hey, fat people, they love food. The only thing they want is just eat and stuff their face. And it's not every fat person who just stuff their face. Yes, everybody loves food. I eat food, but I don't eat as abnormal as other people.
It's a medical condition which is there.
Exactly.
So next time when we talk about, that's why I always say to people that don't put meaning to words. That's what I've learned. Don't put, she knows, I even call her fatty boom boom, because I'm also fat myself. I don't put meaning to words. I'll be like, hey, fat girl, you know, but she knows that it's coming from a good place, and she knows I'm fat myself, you know. I'm like, hey, today I just want to eat fat people's food, you know. So let us also learn to take away the meaning in words, so that when a person throws that words to do, they don't have that impact and they don't hurt you. But the other thing that the moral also of the story is about awareness of thyroid, like you just had, but also that you can, whatever medical condition that you have, you can be whatever that you want to be. I know she's an expert when it comes to IT, and she's doing very well in a career. So having a medical condition is not a limitation. The issue is acceptance, and to know what you're supposed to do. You to know the triggers.
You must have tools to be able to cope with the situation.
Yes.
Like everyone else, even if you're not diagnosed with anything, you have to have tools to cope with life.
Yes.
Life itself is very stressful.
Yes.
So when you have extra medical condition, it's more stressful. That's why you have to have tools. You have to learn. You don't even have to pay therapy like you pay a lot of money.
No.
You can even go to government and do it for free.
Like most of the universities, they do have departments where they have therapy for free. Therapy, guys, is very, very important. Now I believe in it. Now and again, I do go when I, like at work. Most of the companies or organizations, they've got that free service where you can call somebody if you want to talk to someone. Because sometimes you have feelings that you can't really explain, or you just want somebody who's professional. Thank you so much for availing yourself. We have to thank her again. I think I'll bring her back, but when I bring her back, it will be the issue on a career and all that. That there are so many things that women can do in IT, and how broad IT it is. So thank you for listening. Please remember to subscribe, to like, and to share. Until next time.
Bye.
Bye.